Hello, everyone. This is Lianne Gensler from UCSF in San Francisco, reporting for Room Now on day 3 of the conference. And today I wanted to focus on what I think is a very important study that may not have gotten a lot of visibility at the meeting because it was a Ignite talk that happened at the end of the day on day 3. So full disclosure, I'm involved in the study, both for design interpretation of the results and recruitment of patients. But nevertheless, I think it probably is one of the most important studies that will come out this year in this axial spondyloarthritis space. And this is abstract number L15. So this was a late breaker. And there's a couple of reasons why I think this abstract is important for us to talk about. One is it's a late breaker, which means it's new data, and it has not been presented anywhere else. 2 is this is the first head-to-head trial in the axial spondyloarthritis space. And 3 is the primary endpoint was looking at radiographic progression. So the title of this abstract is the effect of Secukinumab versus Adalimumab biosimilar on radiographic progression in patients with radiographic axial spondyloarthritis or ankylosing spondylitis. And this is a phase 3b study. And it was presented by Xenophon Baraliakos. And the approach to the study was to randomize patients with radiographic disease to 3 different arms, 2 different doses of Secukinumab. So this was a study sponsored by Novartis, 150 and 300 milligrams, or an Adalimumab biosimilar, and to follow these patients in a head-to-head fashion for superiority over a 2-year period. These patients were selected for high risk of progression. And so that's another important point here, is that this was an enriched study that included patients that either had to have an elevated C-reactive protein and radiographic disease, or radiographic disease and a syndesmophyte on their spinal imaging at baseline. So really, these are going to be patients that are at high risk for progression. And so the primary endpoint in the study was actually looking at the proportion of patients that had no radiographic progression over the 2-year period based on the MSAS, the Modified Stoke Ankylosing Spondylitis Spinal Score, less than or equal to 0.5. So this is basically no change in that damage. And then they had some secondary endpoints, including the development of new syndesmophytes. So this study is important because it brings up the question of whether one mechanism of action, i.e. an IL-17 inhibitor here, may be better than a TNF inhibitor for radiographic progression. And so they enrolled almost 900 patients, 859 patients to these 3 arms, 1-to-1-to-1, and they followed them up then over 2 years. Most of these patients were men, and that's not surprising because we know men have more inflammation and damage to begin with. They had an average MSAS of 16.6, which is quite a lot of damage to begin with. They had an average high-sensitive C-reactive protein of 20 milligrams per liter, and 73% of them had at least one syndesmophyte at baseline. And so the results of the study showed that at 104 weeks, which is 2 years of follow-up, most of the patients did not have radiographic progression. This is very reassuring to us. And that included almost identically 66% of the Secukinumab arm, was 67%, and 66% of the Adalimumab arm. So there was no difference, no superiority. And in fact, these look very similar in their radiographic outcomes. Similarly, when they looked at the mean change in the MSAS, it was around 0.5 to 0.7, depending on the arm that was evaluated. So very low radiographic progression over 2 years. And this is reassuring to us. So I think my take-homes from the study are that despite the fact that there is no superiority of one mechanism of action over another, this is an enriched population that should progress in a 2-year period. And these patients, most of them did not progress. And I think that's very reassuring. It tells us that when we suppress inflammation, we probably do have benefit, despite the fact we have no randomized control trial data with placebo to show that. And we will never have that because it would not be ethical to follow patients over a 2-year period with no treatment. So in conclusion, I think this is very reassuring to us that patients with high risk of progression when treated with a biologic, regardless of the mechanism, do well, and most of these patients do not progress. This is Lianne Gensler reporting for Room Now on day 3 of ACR Convergence 2022.